Okay. Yeah. So I take the pleasure to welcome all of us on this call on our October eco session, and I mean August eco session. As you know, this is our primary LabCoP session. We have another session that we usually hold for waste management, but this is the principal eco session that we usually hold every month. So I take the pleasure to welcome all of us who are already. Hello. The people who are not speaking, we request you to be on mute. And we request you to go on the chat and register your connection so that we can know who is on the call. We want that information is very important for us monitoring these calls. Then we also want you, if you have a question or any reaction to the presentation, you put it in the chat. At the time of reactions, your question or reaction will be read to the people who are supposed to answer or to react to what you're saying. So if you're not on the one speaking, please keep yourself on mute and let the session move without interruption. So I'm saying I'm welcoming all of us. I want to pass condolences to our Malawi team for having lost their team leader. And I want us to take just a few seconds, a moment of silence in remembrance of one of our very key member, Alwin Meni, who passed away in a motor accident. Just a few seconds. Okay. May his soul rest in eternal peace. We are just remembering our colleague who passed on, Irene from Malawi, who was the team lead in Malawi. But I want to thank the Malawi team for remaining strong. I've already seen a few of them already online. I've seen Kipungu online, and I think others are also online. Thank you very much. Malawi team, Timothy from Malawi, pass all our heartfelt sympathies to the entire Malawi Laboratory for Eternity for that loss. So we have a couple of announcements. We shall make them at the end. So for this moment, I want to hand over our session to our presenters. Today we are having presenters from PCM, PSM, from Washington, who are managing the logistics and supply chain for PEPFAR countries, but they have a product, a solution for laboratory for network optimization. So we want them to talk through network optimization. It's one of the one of the challenges that countries are grappling with in their load program, how to optimize the laboratory networks and optimize the laboratory operations and get everything optimal, short of which there are lots of unnecessary redundancies and inefficiencies and unnecessary costs that are loaded on the program because of sub-optimized networks. So we are going to be going through this again with the team from the supply chain management from the Global Health team in Washington, who are managing the supply chain for the entire PEPFAR countries. Please, somebody managing the mute and unmute the team. These people, Tese, please keep yourself on mute. Okay. So I hand over to Matt and Clement, who are going to be taking us through this presentation we are going to have on network optimization. So Matt and Clement, please, you're welcome to take us. Hello.
Thank you very much, Charles. I appreciate that. Warm welcome, and it's nice to be talking with everyone this morning. I'm going to go ahead and pull up the presentation now. And as Charles said, we're here representing GHSC PSM, which is the Global Health Supply Chain Project, Procurement and Supply Chain Management. And what I'm going to talk about today is a little bit of a follow-on to a presentation I understand took place several months ago with Jason Williams from USAID. And several of the things I want to talk about today are the laboratory supply chain management strategies that we've worked very closely with the PEPFAR stakeholders on developing and rolling out over the last couple of years. And today I'm going to get into a little background of our approach, as well as discussing some of the challenges that we're all familiar with in terms of laboratory scale up. And as well as talking a little bit about the PEPFAR's new strategies, both in terms of viral load scale up and also lab optimization as it relates to clinical service delivery and supply chain management. And then we will wrap up, and hopefully there'll be some time for questions. So with that, we'll get right into it. And I think we all understand the background of viral load scale up, and we are all familiar with the 390s, especially the third 90, to make sure that we have 90% of all patients receiving antiretroviral therapy and that they have virologic suppression. The only reason I highlight this is that there is a increased focus and scrutiny in some way of countries in terms of their reaching their targets and making progress towards that third 90. And even for us as a supply chain project on behalf of PEPFAR, all of our supply chain outcomes are tied, at least for the lab side and for viral load, to that third 90. So it's not just enough for us anymore in the eyes of PEPFAR and OGAC to say, hey, we delivered X number of boxes, but we need to show that those boxes and those viral load supplies are being used to advance the third 90 and are contributing to testing. Further to that background, we know that there's been a lot of progress made in all three of the 90s, especially with viral load over the last several years. But we do know that the—
Matt.
Yes.
I don't know. I'm not seeing your presentation. I don't know whether the rest of the team is seeing it.
Are folks seeing the presentation?
Yeah, we are not.
We are not.
Have you shared it? Okay.
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 Now we are seeing your screen.
Okay. Okay, how's that?
Okay.
Okay, yeah.
Now we are seeing it.
Okay. Apologies, and thanks for that, Nicholas. It was showing me as presenting, but it sounds like we're on the right page. So as I was just saying, I think we're all familiar with the third 90 and the increased focus on tying data and outcomes to all the activities within PEPFAR. It's a very data-driven program right now, and I'm sure we're all aware of that and the need to show progress towards certain goals, and specifically for viral load scale up, that being the third 90 or third 95, even thinking to the future. So we also know that there's been a lot of progress made in terms of viral load scale up across the African continent, but we do know that the epidemic looks slightly different in southern and East Africa compared to West and Central Africa. And this is just to denote that there are some slight differences where we see West and Central Africa slightly behind Southern and East Africa in terms of the third 90 or virological suppression. However, there's been tremendous amount of progress made all over the continent, and that should be well recognized by all the hard work this group and others have put in over the last decade plus of PEPFAR. We also know that in West and Central Africa, we're seeming to get less people tested and aware of their status, and that has a further effect on the cascade. But there are a number of efforts going on now, maybe many of you are part of them, to really focus on West and Central Africa in terms of capacity building and helping to reach targets across all three of the 90s. We also know that the global demand for viral load tests has increased considerably since 2007. And if we continue on sort of a growth trajectory like this, you know, we're looking at possibly up to 21 million tests per annum globally for viral load testing. Although we do see that level off with some modeling by 2021 and 2022 as we hopefully reach more full saturation of patient testing for viral load across all the PEPFAR countries. We also know that over the PEPFAR project, as well as before that, that a lot of laboratory networks grew organically. And we were responding to an emergency as PEPFAR and through the countries, that being the HIV emergency. And so a lot of these networks grew very organically and not necessarily coherently into one system, or maybe not an efficient system that made sense from a cost efficiency standpoint and from a sustainability standpoint. And we know traditionally that programs have focused on really two different types of laboratory networks, whether those are decentralized or centralized, each with its advantages and disadvantages in terms of access to testing and cost efficiencies. However, now I think with the integration of point of care testing as well as conventional testing, we're also looking at hybrid, right? And so how do we integrate point of care testing and more decentralized technologies like GeneXpert or LabCoP and others with more conventional networks, the Roche platforms, the Abbott platform being the M2000, and the new entrant with the Hologic Panther. And how can we create a coherent system that makes sense in terms of sustainability from a funding and management level, but also ultimately meeting the needs of the patients. And as I mentioned earlier, there's been a lot of great work done by many different stakeholders and partners throughout PEPFAR. Just highlighting two here, I think we're all familiar with the slipped and slammed process that was being led through ASLM and CDC and other partners to really improve the quality of laboratories. And so that's at the facility level to perform excellent services and testing. However, even with the great progress that we've made as PEPFAR over the last decade plus, there are several challenges that I think we can all relate to as we continue to strive for meeting the third 90. So as being a procurement and supply chain project, our goal is to address laboratory network inefficiencies that intersect with the supply chain. And one of the challenges being both a procure and a supply chain agency to ensure that all the facilities and programs have the supplies that they need in a timely manner, the right place at the right time in the right quantity, is ensuring that there's a well-defined and planned laboratory network. And in essence, If we don't have a strong understanding in terms of all the stakeholders, both programmatic and donor, in how the network will work, which sites will do testing for which group of patients, which sites will refer samples to which other sites, we cannot do a good job of ensuring that the supply chain is well positioned. In essence, if we don't know which sites are going to be referring samples, how can we ensure that we have the right plasma or DBS commodities at that site? And then at the testing level, making sure that we have enough supplies and commodities to do testing for the entire referral system for that site. And then we also know that in terms of the program at large, there are still some inefficiencies across viral load in terms of the global market. One of those is lack of long-term pricing and long procurement cycle times with the manufacturers in terms of production, and not having consistent pricing across countries. We also have seen uncoordinated instrument procurement amongst donors and programs. And I think we're all aware of the Maputo Declaration in about 2008, where countries said that, and programs said that we were going to standardize and really look to coordinate instruments. Although today there's still some challenges around that, where we're seeing some laboratory networks where we have multiple equipments from multiple different donors, and consolidating that into one network with budget to support it is often a challenge. So there still needs to be work done there in terms of collaboration, in terms of procurement, especially when it comes to new instrument introduction. We still have challenges with cold chain, especially maintaining some of the Roche and Abbott calibrators and controls, which require frozen cold chain and can be a challenge. I've spoke a little bit about some of the sample referral networks in some countries which are not well defined, or there's challenges. In other countries it's working better. And then inefficiencies in terms of low instrument utilization, where we may have, as an example, 10 labs in a country, and one or two of those labs may be operating at 80 or 90% utilization, while the other 8 labs could be under 10% utilization. That's not an uncommon situation that we've seen. So how do we balance the network to create better service for our patients, while also maintaining the utilization and the instruments that we have in labs? And I'll talk about how we do that a little bit later. Also strengthening inventory management, and addressing routine maintenance and frequent breakdown of instruments. And I'm going to talk a little bit about how we're addressing that, both through laboratory network optimization and then in terms of contracting. So with that background, I'm going to re-talk about the new approaches for PEPFAR in terms of viral load scale up. And what we've seen is that laboratory network optimization is the key and first step towards driving effective and efficient procurement and supply chain outcomes. So what you can see here is sort of some of the traditional steps in supply chain. If you look at the top, we've added laboratory network optimization as a critical step before we engage in forecasting and supply planning, strategic sourcing, and performance management. And what we found is that if we don't take a step back and actually optimize laboratory networks before we develop forecasts and supply plans, we don't later see good outcomes in terms of procurement, but also following through on the third 90. At the same time, maintaining efficient budgets, which are being scrutinized even more now in terms of PEPFAR programming. And so taking a big step back and making sure that we have an optimized laboratory network and we're engaging the right stakeholders to really do that analysis and understand the network before we go into planning and actual procurement is the approach that we are working very closely with stakeholders to drive. So what does this mean? It means taking a step back and understanding the baseline functionality of the laboratory network in a country. And that's really focused on three key areas. That's demographic data. So what is the patient population? And really, this helps to provide a dynamic understanding and functionality of the laboratory network, the supportive systems, and ultimately commodity distribution. And this whole cycle, we found, does a much better job of informing the procurement and supply chain management to ensure we have the right commodities at the right place. After we have worked with countries, or countries have developed their sample referral network as well as their viral load network, and there's a comprehensive plan and policy in place, then we go to forecasting and supply planning. And there's two tools that we use. Both are open source, and encourage you to look at those if your organization is involved in forecasting or supply planning for laboratory commodities. 4Lab is our tool for forecasting and quantification of laboratory supplies. There are three methodologies within this software platform. We can do demographic-based methodology, we can do a service-based methodology, or we can do a consumption-based methodology. But we found when we have data on all three areas that we have stronger outcomes. And when this is completed, we can use Pipeline, which is our supply planning tool, also open source, to actually put that forecast into supply plan and create a coherent and efficient supply plan that we can use with manufacturers to prime production planning and prevent stockouts. Ultimately, when we all communicate better in terms of program to supply chain to manufacturer and distributor, we see better outcomes in terms of commodity availability and ultimately testing outcomes. After we have a solid forecast and supply plan, we can more effectively engage through strategic sourcing efforts. And I'm going to talk a little bit about how we're shifting from more capital-based procurement to all-inclusive reagent rental pricing based on the optimized network. Because an outcome of the optimized network, or developing a national laboratory network that is optimized, is that we have a strong understanding of the volumes, which patients will be tested where, and ultimately that information can be used to improve service outcomes with vendors and distributors and ultimately get the best pricing. The last piece is performance management. So it doesn't stop when we've created contracts or we've started procuring, but then actually doing regular monitoring, especially as it relates to service level agreements and servicing of instruments. I think we all know the challenges of maintaining some of this molecular equipment in our environments. And so having regular interaction with our distributors and service providers based on KPIs that look at uptime, response time, error rates, and have regular interactions with those distributors and suppliers to make sure we're getting the service that we need and that PEPFAR is paying for. So I've talked sort of abstractly about network optimization, other than the three pillars of data, which again were the GIS locations, the patient demographic data, and the instrument operational characteristics. But what are the elements that make up a robust laboratory network optimization? So one thing that's key for us is continuous stakeholder engagement throughout the process. And this is done through regular communication and meetings, usually held virtually, where we take a look at data and we go through an iterative process of refining and modeling that data with the stakeholders, and that includes Ministry of Health, implementing partners, as well as ministry, as well as other ministry groups, USAID and CDC. And I would just say that this is not, when we talk about laboratory network optimization, this is not PSM going in or doing some calculations in a dark room and then sharing it. The way that this is successful is through, as I said, engaging all the stakeholders and building through an iterative process a virtual model of the country through analysis and mapping platforms. And this is done through consensus building and co-development of an operational plan and technical working group that would actually stand up the operational plan during the lab optimization exercise. And what that group does is basically help take the country, after the analysis is done, take a country from its current state to its future optimized state. As you can imagine, there's a lot of steps involved in that. If the network is going to be redefined, or equipment will be moved, or new sites will be referring to new sites, there's a lot of operational elements that have to happen there, and it's important for all the stakeholders to be on the same page about what that looks like. Ultimately, this is a very data-heavy exercise, so data collection, cleaning, and validation makes up a large part of it. And we go through the data and revisualize it and create many different models and analysis, so stakeholders can make informed decisions about where they want the network to go. And then ultimately, we're looking for data-driven implementation. So to do this right, it requires working closely with Ministry of Health, USAID, CDC, implementing partners and other global stakeholders, which may include Global Fund, UNITAID, or other donors, depending on what the country looks like. And that's so important because we, as we said, we don't want to see uncoordinated procurement. We want to understand how instruments and network sites are fitting into the strategic plan for the country and ultimately meeting the third 90. And there's a couple of different stages, or sort of a hierarchy, if you want to consider that, of actually mapping and optimizing. And at the most basic level, we can actually map, and I know ASLM is doing a great job of that with their mapping initiative. But we can map geolocation of laboratories and facilities at a very basic level. The next step would be actually to optimize site selection and placement. So where are those sites in relation to where patients are located, and do those sites make sense for the epidemic in that country? And then also considering point of care integration, whether that's slack capacity from gene expert instruments that is now also going to be used for viral load, or actually integrating other point of care technologies exclusively for viral load or EID testing. And really looking at utilization rates and equipment throughput. Lastly, redesigning a network based on a country's needs, or MOH's needs, and also budget, while also considering future program growth and scale up depending where a country is in terms of managing the third 90. We've also looked at integrating HIV and TB referral services. So if you have one site that refers samples for both TB and HIV, so let's say plasma and sputum, or do we have two different transport vehicles going to that site every day? Is there an opportunity to consolidate some of the referral linkages and consolidate some of the funding to create efficiencies and ultimately have more funds for contributing to patient testing? And in some cases, we've actually established national integrated sample transportation network if it was the vision of the ministry. And some of the work that went on in both Nigeria and Zimbabwe was around looking at integration of sample referral networks and consolidating, and also having visibility for the ministry to understand how that was happening and where there were opportunities for synergies and cost savings. Just two shots here from two of the exercises that were done. These are snapshots from the LabCoP tool. LabCoP is our open source software tool for lab optimization. It does have limitations, but it is available for download on our website, and we'll make sure you guys get that information for those that are interested. But the tool does allow you to input GIS locations, patient data, as well as instrument characteristics, and start to create visualizations and optimizations based on equipment throughput, as well as site locations. So on the left, going back to the slide in the diagram here, we worked with this country to actually reduce its CD4 equipment footprint, because in this country, the government actually had to reallocate some funding from originally that was programmed for CD4 to change it over to viral load to meet the budget. And basically what we were able to do here is help the country save around $200,000 in upfront procurement and about $60,000 in annual operating costs, simply by redesigning the network and moving some instruments around. We're able to keep high utilization rates in the instruments as well as meet the needs of the patient. On the right, we worked very closely with the ministry and stakeholders to develop an integrated sample transport network for HIV and TB. And just to give you a sense of what some of the GIS modeling looks like and the referral linkage mapping that we're able to do. This has led us to also drive towards a global RFP that includes all-inclusive reagent rental. And what this means is the traditional model where we procured equipment, we procured commodities, and we procured service contracts was not always so efficient in terms of outcomes or cost. And what we've been driving at a global level is for more flatlined pricing across countries, but that also includes an all-inclusive price per test. And in some cases, we're even wanting to see more services provided by the distributors. And this also includes leasing or placement of equipment in testing laboratories, as well as data solutions to be considered, including patient result transmission and instrument performance for managing service contracts. And I won't spend too much time on this slide, and there's just a couple more slides to go, but just highlighting the differences between the traditional approach with sort of upfront CapEx investment versus reagent rental. And what we can have seen is that, on a price per test basis, the traditional approach can be very high and variable per country, where some countries are paying at least historically up to $100 per test, while other countries pay as low as $8 per test. And it also makes budgeting easier in terms of donor and across programs. And we've seen that the efficiency and coordination becomes much easier in this environment. So how can this benefit your program? As I said earlier, laboratory network optimization and mapping is a first step to actively and efficiently informing the procurement and sourcing cycle. And we're doing that through our reagent rental agreements, the Global VL RFP, which we expect to see significant cost savings for all PEPFAR countries, and through our basic ordering agreements, which ultimately can improve the utilization of equipment, help us balance conventional and POC technologies, better service and maintenance performance, and a healthier supply market. And ultimately, all of this is to help drive improved patient management, cost efficiencies and savings, uninterrupted testing services for our patients, and timely delivery of results. And if we do all these things and we do them well as a global community, we're going to meet the third 90. And there's been a lot of progress made towards that, and we will get there very soon. I know it. So in conclusion, we've talked a little bit about the new approaches to address viral scale-up challenges, especially in the context of laboratory optimization and supply chain management. But again, considering that laboratory and sample referral network optimization is a first step to improving laboratory supply chains globally and also in individual countries. And when we do this and we can lead to forecasting and multi-methods, using multi-methods and efficient supply planning, we're able to better inform strategic sourcing and the long-term agreements, as well as reagent rental model with suppliers. And lastly, performance management to ensure that we are actively managing our contracts and getting the value that we are paying for with our distributors and suppliers. So now is the time to start thinking about laboratory network optimization. Key discussions should be had with Ministry of Health, as well as USAID and CDC, where appropriate. GSC PSM works in many of the PEPFAR countries, and we do have field offices in many of the countries. And we'd love to be part of the discussion and help drive this forward with the group of stakeholders in your country as appropriate. I've attached our listserv here as well, where you can contact us for more information if needed, and we'd love to hear from you. Just a slide here, show you the team. From left to right is Aloysius Bingi, myself, Matt Wattleworth, Shadrach Weary, Lillian Gu, and Clement Ndongmo. And Clement was, we were hoping could join us today, but was not able to due to a conflict with a quantification exercise for Haiti. But he's also available. With that, I will open it to questions, and thank you for your time and attention.
Matt, thank you very much for that presentation, which was very, very clear. I know people have been following, and they must be having a couple of reactions, so in whichever form of questions or seeking clarifications here and there. I will open it up now to the audience to react to the presentation on network optimization. This is very central in optimizing the use of resources and getting value for money. Countries have got many troubles around this. So I will open it up for the audience to react. Nicholas, you've been monitoring the chat. You have some questions in the chat.
Yeah, thank you very much, Dr. Charles. There is no question in the chat. There are no questions in the chat box. I think people will just prefer to ask the questions verbally. Thank you.
Okay.
Sure.
So since you have not put questions in the chat, we open it up. I think you can indicate that you have a question. You can do that by there is a function of a hand that you can use so we can see, or you can even indicate by show of your hand that you want to ask a question. So the audience, please, this is your moment to react to the presentation that has been made. Hello?
Well,
Okay, we have
Go ahead.
We have a question.
We have one question from Mary Beckley, and she's asking, will this only work for big hospital systems? Will this only work for big hospital systems? Mary, I don't know whether I would want to clarify more on your question verbally.
Yeah, And thanks, Nicholas and Marie. And maybe I could try to answer that. And if there's any follow-ups, Marie, I'd be happy to answer those as well. And to that, I would say, no, this will not only work for big hospital systems. This will work for all hospitals. And actually, it's not, this approach is not specific to one hospital or site within a network, but looking more holistically at a network. So not necessarily how does a network or site function within its walls, but how does the different laboratories interact with each other? In essence, is that site going to be a collection site for samples? Is it going to be a hub for consolidating samples, or is it going to be a testing lab? And how do the sites all work together? And is it an efficient system in terms of the national picture, in terms of patient population, testing outcomes, and cost? So it should really be, what we'd like to see is the entire network be included in a process like this, whether it's a small clinic or a big centralized laboratory. It's about mapping, getting them into the network, understanding their place within the hierarchy, and does that system make sense? Is there a better way to do it for sustainability for MOHs and for cost? Or does the system or specific referral linkage make sense? And I don't know if that answers your question, Marie, but it's really an approach for the whole system, not site specific.
Okay.
Okay, looks like there's a follow-up from Marie here too. She's saying, for a private testing lab, there's a third-party provider for government hospitals. Yes, I would say that, and I am familiar with this model. In several countries, there's actually a system where a private lab or another service provider outside of the government system will provide viral load testing services and charge that to the program or the government. Even in that case, I would say, yes, we would want that included, because even for a private testing lab, unless it's already been clearly defined which cohort of patients you would be testing for and which sites or samples would be sent to which labs, or in your case, your lab, would give you a better idea of the commodities, supplies that you needed to meet the needs of those patients. And it's also, even in a private testing lab situation, most likely that system will be in parallel or part of a larger government system that also provides viral load testing. And if we don't understand in a country how we're going to service the entire patient population, it makes it hard to really understand if we are efficiently testing within certain systems, whether it's private or government. So what we would advocate for is that for the entire PEPFAR program, regardless of it's public or private, that those be included if that is part of the National Strategic Plan for Viral Load Testing. Thanks, Marie. Oh, and Clement, looks like you've also got something.
Hello?
Yes.
Yes.
Hi, Matt. I'm sorry. Actually, my connection couldn't work. I finally tried to use my cell phone.
Oh, okay.
But I'm sure you did a great job. And hi to everyone. Sorry, I'm calling from an assignment in Haiti and couldn't join because of connection issues. But I'm glad that Matt was able to take you through all the presentation.
Okay.
Absolutely. And we're just answering some questions now, Clement, and thank you, Marie. And I don't know if we have any others.
Yeah, I'm seeing some.
This is
great. Yep. It looks like I see a question from Anafi, who's asking, what do you think the greatest challenge or barrier is to network optimization in countries? I think two things. One, the big one is data collection. So this is a data heavy exercise. And frankly, we can't do the analysis or do it well without all the pieces working together. So oftentimes, we have HIV programs and TB programs, and the two programs don't always play nice or, share data across each other. But Where we've seen it work the best is where there is buy-in to share data and analyze the data together. I would also say the other challenge is in stakeholder engagement. So, you know, as I mentioned earlier, laboratory network optimization is not about, you know, me or Clement or any of us at PSM or any agency sitting in a dark basement somewhere doing little maps and calculations. It's about using those tools to engage stakeholders to help drive policy and decision making. And we know that consensus building and stakeholder engagement can be a challenge, but what we found is if you don't do it during the process, that when it gets time for operationalizing the future optimized state, that it doesn't have to happen effectively. So getting that stakeholder buy-in from IPs, Ministry of Health, donors, and others using the data is the key, but also the greatest challenge, I think.
Okay, thank you very much. We have another question from Shaukat Khan, and she is asking, how do you balance the cost savings expected with the network versus the required budget that may be needed to implement the operation plan? She continues to say, implementation may require substantial investment for human resource, infrastructure, and so on. Do you expect some degree of budget allocation or commitment from partners ahead of time?
So that's a great question, and I think it speaks to exactly what we're talking about here, which is moving to the future state or future optimized network is not something that just happens. And how do you align stakeholders around that? I will say that every country is slightly different, but again, we work very closely with USAID and CDC. And of course, ministries of health and all these exercises. So the implementation often does require investment in terms of HR infrastructure or adjustments. In several of the cases, again, working through USAID and CDC, and then engaging the local implementing partners, we did just that. So budget allocation in terms of clinical partners did align with operational plans. It wasn't forced on anyone, but again, it was part of the workshop and part of the considerations for moving to the future state. Because as you've rightly said, if we need to move equipment from one lab to another or add an additional testing lab and equipment, there's a cost to that. There's training, there's installation, and then there's the ongoing efforts of partners to ensure that those sites are delivering excellent and quality testing services. So it's about engaging those stakeholders, and they are there through the process, through USAID and CDC, as well as the implementing partners. So it's a great comment, and absolutely has to be done. Budget is a key part of it, together with USAID and CDC COP funding.
And Matt, I just want to add that given the budget limitation, I mean, the whole idea, like you said, is cost efficiency. So the upfront investment in conducting this exercise actually leads to cost savings across the program. And also we can build different scenarios and take a stepwise approach where you implement partially in probably the current year and have enough time to budget for further scale up and expansion in the implementation process.
Okay,
Absolutely.
thank you very much. The other question from Ellen Nansumba, she's asking, for neighboring countries with low coverage of HIV or TB, is it possible to negotiate reagent prices together?
Yeah, so thanks for the question, Helen. And to that, I would say yes, it is possible. What we found is the key to all our negotiations is, again, data, right? And so you have to remember that manufacturers and distributors are in business. And the key for them is to understand what volumes are going to look like. So one of the key things before entering into any negotiation is to understand what is the burden of those two diseases, and ultimately what will be the commodity need for each of those disease burdens. When you have that total volume information, then you can more actively and efficiently negotiate, engage suppliers, because then it's really grounded in the need, but also that price is usually a function of volume. In other words, the more tests you do, the lower the price per test. And I'm sure that's a concept that's not hard for us to stand. When you get a better price when you buy more, especially for HIV and TB. When we think about like Cepheid, for instance, that has both MTB diagnostics as well as HIV, viral load, and EID, there is an opportunity where we've seen in some countries you can actually consolidate both the demand for cartridges and get better pricing across. So it's key, but the key is to having concrete volume, so that's budget as well as forecasted patient information, so that entering negotiations with suppliers, you have a strong foundation from which the demand is gonna rest. And Clement, feel free to add anything you might think is appropriate.
Okay, thank you very much.
Okay.
The other question is from me myself. I want to ask whether you have some opportunities, for example, free online courses where our community may benefit. There may be courses about supply chain management or courses about network optimization. Are there any?
That's a great question, Nicholas. There are several free courses out there on supply chain management that are available through some of the MIT platform. Harvard has one. These are free open source classes. In terms of GHC PSM, our training is usually done through USAID. And usually goes out through the USAID missions. We did do a regional training about 2 years ago. We'll hopefully have one coming up this year. And again, we're working on behalf of USAID. So in most cases, they develop the attendees list for those exercises in conjunction with the missions. But one thing that we have explored is doing more webinars or a series on network optimization, and we can continue to explore that, so that there are more resources and materials out there for people that are interested.
Okay, we are about to stop the questions because we have a few announcements, but I also have a question. Okay, you said the LabCoP tool is an open source one and is available. How
That's
can
correct.
people access? How can the community members access it? And do you have a user guide to it, or is there a training that goes with it? And then another question is, okay, you said this whole exercise is data intensive. There is routine data that is collected through programs, but then there is data which is not necessarily routine. For instance, like collecting coordinates for the facilities that you want to network. Is that would expect the country to have, or if you are coming to do that, do you come specially to collect this data for coordinates? How do you expect to have, especially that non-routine data? What is your experience, and how do you handle that with countries?
Absolutely. Thanks for the question. So the first thing I want to say is that I will type in the chat box. I will send out the link to download the software from our website. So that's actually the LabCoP tool, and the user guide should be embedded right within the software. But I will say that it's not something that is really plug and play that people can just open up and use firsthand. There does need to be training to go along with it. I mean, we encourage people to play with it, and some people certainly can figure it out. We would like to do more training, frankly, on the use of LabCoP, and we will continue to work with USAID to know if that is possible. and we were able to develop this tool being open source so that people could use it. The second side of that is now training folks, and I think it's useful for this group to also give that feedback to USAID that you would want to see that type of training, either on a global level or in your specific country, because everything we do needs to be approved and go through USAID. That's how our contract works. Again, I'll share the link, and folks can definitely take a look at that. Charles, what was the last part of your question? I'm sorry. Oh, coordinates, GIS coordinates. So GIS coordinates, there's a couple ways to do it. The first and most preferred way is to work through the ministry. But if that's not possible, or the ministry asks that, hey, can we help them do that? There are a number of online tools where you can actually go on, and free tools, and you can go on, you can map GIS coordinates by the nearest township, city, or district, as well as there's actually some other free apps where if someone was interested, they could go physically to a site, or a team of people could go to different sites, and on the app, you can actually track your GIS location, and you could sort of flag that GIS location as that site and collect the data that way. So those are sort of the three ways that it can be done, through the ministry, which is the preferred option, actually going to the site and logging those GIS coordinates, or the third one is using a platform through the internet that estimates GIS locations based on site or administrative district.
Okay, thank you very much. I know there are still more questions, but of course, 1 hour is not enough for us to exhaust such a very extensive field. So the discussion continues on WhatsApp. If Matt and Clement, you are not on our WhatsApp, please send us your phone numbers and we'll put you on the WhatsApp so that you can respond to the questions that the members will pose. So in the next couple, somebody, I think you need to mute these people. Yes, so Matt and Clement, we need you on the LabCoP WhatsApp so that you can answer the questions. Nicholas, you pick those questions and put them on the WhatsApp, those that have been put, and the rest of the other questions, let them continue. Let the discussion continue on WhatsApp. I just have a few announcements.
Oh, Charles, thanks for that. I just want to say that I posted the link in the chat box to our Global Health Supply Chain page. From this site, you can actually download the LabCoP tool. So that is available here for folks that are interested in the chat line. Thank you.
Okay, welcome. Thank you. So send us your phone numbers if you are not on the LabCoP WhatsApp so that we can put you on, and anybody else who wants to be on the WhatsApp group so that the discussion continues. I have a few announcements. Country teams, we sent you the self-assessment tool, the viral load self-assessment tool. We expect the feedback to come before end of this week because the exercise was supposed to end by end of August. So please, if you have not yet sent your assessment tool that has been filled, can you please do it within the next few days? Send it by mail, send it to my mail, and we will receive and do the necessary. We will do the analysis ahead of the face-to-face meeting. We have already communicated to you. We have a face-to-face, our new face-to-face meeting, which is happening in October 22nd to 24th in Addis Ababa. More information will come along the way, but this assessment process is part of the preparations for that meeting. And the outcome of this analysis will inform the focus of that meeting. Please make sure by end of this week you have sent in your objectively assessment tool so that we can analyze this data and make it available to you, and also make it available to you ahead of the meeting, but also during the meeting. Use the outcome of this assessment to guide the discussion. Then we are yet, if we haven't yet sent you the demand creation hashtag that we want the country teams to develop. We want you to develop a hashtag and the messaging that promotes the utilization of the demand creation for viral load monitoring, as well as utilization of viral load results. So we'll be giving you more information, but each country, you're going to develop your own hashtag as well as a message that is going to be pushed on social media, on your social media platforms before, ahead of the face-to-face meeting. And then during the face-to-face meeting, the hashtag that you're going to develop and the message are going to be assessed by a jury that is going to be at the face-to-face meeting, and the one that looks to be more appealing and spot on will be selected as a leading one, and you'll be awarded as a country for having come out with the most appealing hashtag and message that promotes the utilization of viral load pieces. So when that message, when that guide comes, please work with your country team to develop the most compelling, the most catchy hashtag, as well as a message that promotes the use of viral load, and push it on your social media platforms. They are going to assess the shares and the likes of your hashtag that you have pushed out, and see which one has really had more impact before we can select who is the best and award them for that. And then that hashtag and message will be used for subsequent demand creation efforts that we are going to be promoting as a program, and working with countries to promote demand creation for viral load and result utilization. Thank you very much for that session that we have had. You'll be getting lots of messages in the course of time, given what we are working with in preparation for the face-to-face meeting. And please respond promptly whenever we reach out to you, because we have very tight timelines within which to push through so many things and make